The Gambia is still one of the countries with the lowest number of vaccinated people against the overall population. At the height of the COVID-19 vaccine campaign in the Gambia, many Gambians were reluctant to get their jabs due to different theories about the effectiveness and the consequences of the vaccines being peddled around. Now, notwithstanding, many have gone on to take the jabs, especially frontline workers like health workers, government officials, members of the security services, and frequent travelers. Now, so far, about 22% of the Gambia population has taken their first dose, while 18% are said to be fully vaccinated. Now, 3 vaccines were available in the Gambia and in the name of Johnson & Johnson, Oxford AstraZeneca, and also Sinopharm. Now, there have been 12,009 infectious and 365 coronavirus-related deaths reported in the country since the pandemic began. Now, this excerpt sets out some of the requirements by the Health Ministry during those trying times in the Gambia. Let's hear more of that.
Initially, when we started, our intention was to target health workers first. Until we finish with them, then we fall back to the rest of the population. But it was realized that we have far more than the public health those working in the health sector. So, and then it will be better for us to also incorporate those with comorbidity. That is for hypertension, those with hypertension, those with diabetes, those with other chronic respiratory conditions, and so on. So that's what we have now adopted. Health workers will be vaccinated. If you have comorbidity, you can prove it that you have comorbidity. When you go to the vaccination centers, they will vaccinate you. If you are 65 and above, is also a target for vaccination. So these are the people we want to vaccinate so far. But then the rest of the population, during the subsequent phases of the vaccination, they will be covered. The only people that would be covered are those from 18 years and up.